Hello, everyone. I'm Dr. Li from Beijing Friendship Hospital, Capital Medical University. The topic I will share today is the performance of disposable versus reusable gastroscope, a prospective randomized non-inferiority trial. Reprocessing procedures of the endoscope are tedious and time-consuming. As a result, the EndoFresh disposable electronic gastroscope with an electronic endoscope imaging processor have been recently developed. FDA, CE, and NMPA have already approved this device for use in examination, treatment of upper GI tract. We conducted a study to evaluate the image quality, operability, operating time, and safety of the disposable gastroscope. A total of 110 patients requiring gastroscopy were randomized to either the disposable or reusable digital gastroscope group. The primary endpoint was the success rate of photographing anatomy site with a non-inferiority margin of 8%. Secondary endpoints include technical performance factors such as gastroscope imaging quality, maneuverability, gastroscopy completion rate, the device failure and defect rate, operating time, and safety. A total of 110 subjects experienced non-adverse events, indicating a good safety profile in both groups and suggesting that gastroscopy does not cause immediate or delayed harm. The disposable gastroscope proved effective in terms of the insertion, handling, and visualization of the upper GI tract, and its diagnostic accuracy was not inferior to that of the conventional endoscope. Gastrointestinal endoscopy is playing an increasingly important role in the routine examination and diagnosis and treatment of the GI diseases. Endoscope-transmitted infection may be a rare event, but even a rare rate of endoscopic cross-contamination could affect the health of individuals. A disposable gastroscope may be an important option for minimizing and eventually eliminating the risk of endoscopically transmitted infections. Despite advancements over the years, the gastrointestinal endoscope remains a delicate instrument and requires careful maintenance. The endoscope could be damaged as a result of improper operation of the endoscope injection needles or tissue adhesive injection. Accordingly, disposable gastroscope may provide a satisfactory solution. Patients with signs of gastrointestinal bleeding and hemodynamic instability should be offered urgent endoscopy. These patients stay in emergency room or intensive care unit because of the critical illness. Hospital transfer through endoscopic suite has a lot of risk. Bedside endoscopy is an optimal solution in this situation. It is not impractical to equip each department of the hospital with endoscope and imaging systems. Disposable endoscopes with smaller occupied space and lighter weight have the advantage over reusable endoscopes and represent an alternative to reusable endoscopes. In addition to the possible contamination and high cost for maintenance and repair for conventional gastroscopes, disposable gastroscopes are an acceptable bedside tool with an important role not only in the emergency room and intensive care unit, but also in certain circumstances. Just like for patients with severe immune deficiency disorder, on warships, and in disaster areas, remote regions, field hospitals, mobile hospitals, especially during the COVID-19 pandemic. The application of the disposable gastroscope in a COVID-19 patient with gastrointestinal bleeding was reported recently by a Chinese doctor. Currently, a clinical trial to evaluate the performance and safety of disposable gastroscope at the emergency bedside and intraoperative diagnosis and treatment is ongoing in another institution. Of particular note is that this is a non-inferiority trial, and the performance of the disposable gastroscope was not quite as good as that of the reusable gastroscope. However, improvement can be made to the image quality and maneuverability in the future. Besides, according to the manufacturer's plan, there will be more types of the GI endoscopes for different surgical ways, and the image processor will be more intelligent. When the efficacy and reliability of a disposable gastroscope was no longer in question, cost will become the main concern. Although disposable endoscopes are currently expensive, the cost would decrease over time as production scales up. Furthermore, the potential environmental impact of disposable gastroscope remains unknown, but should not be ignored. However, cost-effectiveness analysis should be performed considering all aspects related to economic value and health effects. In conclusion, disposable gastroscopes are effective, operable, and safe, and are a favorable operation in certain circumstances. Thank you.